experiencing frequent bladder infections?
Yeah,
Are you suffering from leaking, burning, always having to go but never being able to?
Yeah, I am. I'm having a lot of those problems. But just call me Sissy, by the way. I hope you don't mind. I brought some notes with me. It's just I've been struggling with these bladder infections for so long. I just really need some help.
Do you need a pen to write some things down?
Thank you.
No, no problem. Well, Sissy, we ran your urine analysis and you're suffering from a urinary bladder infection. We call this a bladder infection instead of a normal urinary tract infection because there is an upper and lower part of your urinary system. Yours just affects your bladder, the lower part. Therefore, we just call it a bladder infection, which is not as severe or dangerous, which is a good thing.
So I get these a lot, but nobody really ever explains what the problem is. So could you just give me a few more details?
Of course I can. UBIs occur when there is a bacteria infection in your bladder. Usually, urine is free of bacteria, but it does contain fluids, salts, and waste products. Infections occur when bacteria first travel through to the urethra. Bacteria can get inside the urethra a number of ways. Then, when the bacteria multiply, infection can occur. The most frequent bacteria is E. coli. Women are prone to get them more frequently because our urethra isn't as long as men's. Does this answer your question?
Oh, yeah, thank you. So what can we do to treat this, Dr. Yateman? I heard these nurses talking earlier, and they were saying something about maybe getting an IV and having to stay in the hospital. And I'm just so scared of needles, and I just don't want to mess with those nasty bags. So is there something maybe I can just take by mouth?
Oh no, don't you worry. I'm not going to hospitalize you or make you have a nasty bag. But don't be a sissy. Those bags will make you well. I'm going to write you a prescription for a higher dose in a longer amount of time since this has become frequent.
Okay.
I think this will work better than the IVs. IVs are for severe cases, and yours isn't severe, just frequent. Oral antibiotics will get rid of the bacteria in your bladder and urethra.
Okay, that's great. I can do an antibiotic. So, how can we prevent this from happening in the future?
There are several ways. Several ways to prevent this from happening. Always urinate after you have intercourse. If you go out of the country, make sure you get a parasite cleanse after because sometimes these can cause bladder infections. Drink plenty of water. Always go when you need to go. Don't wait. Try to drink a cup of cranberry juice every day. Wipe correctly. Always front to back. Here's your prescription, and you should feel better within 1 to 2 days. I'd like to see you back in 2 weeks for a follow-up. Also, if you have any questions, concerns, or you're not feeling better within 2 days, please don't hesitate to call our office during office hours, and my cell is on the prescription for you to call if it's after hours. It was a pleasure to meet you, Ms. Bagwell. Praying this all passes away quickly.
Thank you, Dr. Yateman.